Claudia Anderson from Family Dental Care Park Ridge, and welcome to another segment of Word of Mouth Wednesday. Today we're going to talk about inflammation. We're going to talk about inflammation because people often get confused between the terms inflammation and infection. And inflammation is something that a lot of times our patients present with in the dental office, and I'll explain that to you in a couple of minutes. The word inflammation comes from the Latin word inflammare, which means to set on fire. Because typically when you have inflammation, whether it be a scrape or a bruise on your elbow or your knee where you skinned yourself or bumped yourself, inflammation causes redness in the area. It causes it to get warmer often, a little bit of swelling, and some pain. Those are the most common symptoms of inflammation. So you stop and think and you go, well, do we get inflammation in our mouth? And of course, the answer is of course we do, in various ways. One of the most common complaints or questions that patients have for us in our office is they will talk about a pain in a particular tooth that may have only lasted for a short amount of time, and it only felt painful in certain circumstances, and it was maybe correlated with they had maybe gotten some popcorn caught between their teeth or some kind of irritant. Inflammation is our body's healthy, actually, response to an irritant or to a pathogen. So if bacteria settles in an area, or if an irritant settles in an area, you're going to have an inflammatory response. It's your body's healthy attempt to remove the irritant, to remove the pathogen. So inflammation in and of itself is not a bad thing. It's actually quite a healthy thing. It means your body's working to protect you. One of the things that we can do if inflammation gets too uncomfortable, if the pain is just a little too much for us to bear, if we're having difficulty sleeping because of it, you can take anti-inflammatories, such as ibuprofen. Ibuprofen is one of the best ones. So Motrin, Nuprin, Advil, those are great anti-inflammatories, and you can get those over the counter, and they're quite effective. So what are some of the times that patients in a dental office may present with inflammation? Well, as I mentioned before, if you have an irritant like popcorn kernels or a seed from a poppy bun or something that is just small and gets caught in between your teeth, and maybe you weren't able to floss it away, or maybe you're just not a flosser, sometimes that irritant can stay around long enough that the body perceives it as a foreign object and wants to get rid of it. And in doing so, the blood cells increase in that area. So your vascular response, your blood system response, is to increase the blood flow to that area to try to destroy the irritant. And in doing so, what happens to you as a symptom is that there's often redness around maybe the gums in that area, sometimes a little swelling, and sometimes the pain that you will experience is what we call pressure pain, because there's swelling around the tooth, around it, not in it, that can cause a pressure every time you bite on it or push against the tooth. And so that would be an inflammatory response most often. And typically an inflammatory response, whether or not you take anti-inflammatories, will last anywhere from 7 to 10 days. And it seems to peak and then wane. So if you're having symptoms in your mouth and you can correlate it to perhaps some kind of an irritant, and you find that it kind of progressively gets a little more uncomfortable and lasts for a couple of days and then seems to be subsiding, chances are you've had an inflammatory response and your body did what it was supposed to do, and that was to get rid of the irritant on its own by this inflammatory response. Whenever you have that kind of a symptom, it's always best to call your dentist and find out for sure if that's what the dentist concurs with, that in fact it is an inflammatory response. Sometimes we like to see you. We like to see the area that seems to be giving you some problems. Sometimes we want to take an x-ray. There are certain signs that we can look at on x-rays that would determine if you have an inflammatory response. So if you feel that you're getting an inflammatory response and you're not sure what it is, and you just want to verify, it's always a good idea to call your dentist. And it's always a good idea to differentiate between an inflammatory response and an infection, because those are both treated quite differently. And the symptoms are a little bit different, and the dentist would be able to help you with that. So that's the information that I wanted to share with you about inflammation. It's very common. Flossing certainly can help to decrease the amount of irritants that would get caught between your teeth that may in fact cause inflammation. But sometimes even the best flossers have episodes of inflammation, and so it's not always the end-all be-all. So if you ever have any questions regarding any discomfort in your mouth, any questions about inflammation, please feel free to call us. We'd be happy to help you out with that. Or you can email us at info@parkridgedds.com. And remember, as always, we love making you smile.